Good afternoon, and welcome to today's Rural Opportunity and Development session, Rebuilding with Care, Advancing Quality Childcare in Rural Places. I am Rob Grunwald, economist in the Community Development and Engagement Division at the Federal Reserve Bank of Minneapolis. Childcare is a key workforce support to help parents enter the labor force and be productive at their jobs. Quality childcare settings also support child development and help children enter school prepared to succeed. That's why today's webinar refers to advancing quality childcare in rural areas. As we will hear, childcare has unique challenges in rural areas, and there are a number of innovative ways to address those challenges. We'll go to the next slide. Today's event partners include the Community Strategies Group at the Aspen Institute, the Rural Community Assistance Partnership, Rural LISC, the Housing Assistance Council, and the Board of Governors of the Federal Reserve System. Today's event is also in collaboration with the Federal Reserve Banks of Minneapolis and St. Louis. I'll go to the next slide. The Rural Opportunity and Development, or ROAD sessions, are designed to highlight and unpack rural development ideas and strategies that are critical in response to COVID-19 and to long-term rebuilding and recovery. Each session features diverse practitioners who share their experiences and innovation on addressing rural America's challenges. Goals include highlighting rural assets, bringing solutions into policymaking and practice, and strengthening the networking of organizations that serve rural communities and regions. And go to the next slide. Today's panel discussion will run until 3:15 p.m. Eastern Time, followed by an optional breakout room session designed to meet others, ask questions, and share your own thinking and experience. Toward the end of the panel discussion, we will drop a link into the breakout room session in the chat box. And next slide. Today, we will be using both the chat box and the Q&A box. So note the different uses listed here. Use the chat box to share insights or to echo or underline a panelist point. Use the Q&A box to ask questions of the speakers. We will use the last 15 minutes of the panel discussion and the breakout sessions to respond to questions submitted in the Q&A box. And next slide. Finally, here are some housekeeping items to keep in mind during the session. If you have tech issues, use the chat box to ask for help. When we get to the end of the panel discussion, enter the breakout discussion by clicking on the link provided to you in the chat box, or you can also use the link in the email you received today. Next slide. I'm honored to introduce our moderator for today's webinar, my colleague Samantha Evans, Community Development Advisor for Workforce Development at the Federal Reserve Bank of St. Louis. Sam is active in many community organizations and serves on the advisory board for the University of Central Arkansas Community Development Institute. Sam, I will turn the program over to you.
Great, Rob, and thank you so much. And I want to thank the Aspen Institute and its ROADS partners for putting this together and providing a space and opportunity for us to be able to come together to discuss rural childcare, both as challenges as well as share opportunities for us to build partnerships to move forward. And I want to thank you for participating, for being with us this morning or afternoon, albeit virtually, as we're going through our technical difficulties. I'm truly excited for us to have this conversation and to welcome our speakers today, which includes Corrine Hendrickson, owner and operator of Corrine's Little Explorers Care Center, Barb Farber, CEO of Indigenous Visioning, Travis Staton, CEO of United Way of Southwest Virginia, as well as Allie Richards, who's the CEO of Let's Grow Kids. And we'll talk with them in a little bit, but really, as Bob has highlighted, our speakers will be able to provide us with practical stories from on-the-ground experience. And before I get into the context and data and conversation with our speakers, I want to be able to share our disclaimer. So if you could go to that next slide, please. If you have ever heard anybody from the Federal Reserve before, you have seen this. I speak for myself and just for myself. So the comments and the thoughts that I'm going to share with you today do not necessarily reflect the views of the Federal Reserve Bank of St. Louis or the Federal Reserve System. Let's go to the next slide. And if you're not already familiar with the Federal Reserve, we are the central bank of the United States. We have responsibility for monetary policy, which you can think about that as maintaining full employment or maximum employment in the United States, as well as maintaining stable prices. Our community development and our research functions have come together to conduct research and provide outreach and early care and education issues that affect low income as well as moderate income and underserved households and communities within each one of our reserve districts. So as you're hearing some things today, I really encourage you to reach out to the reserve district in your backyard as you begin to understand these challenges within your own communities. Or better yet, check out fedcommunities.org to understand our work and the stories and people that make up that work. Continue to the next slide, please. Thank you. So understandably, we know choosing a childcare program is a complex decision for families. As a single mother myself, and beginning my career during the Great Recession, while living in a community with a population of 350 people, a community that did not have a stoplight nor a childcare center for miles. There were many factors that included that I had to think about, and that included cost, transportation, location, and quality that influenced my decisions for where I often relied on my FFN, my family, friends, and neighbors. But as we continue to come to understand the childcare system as a whole and not just a set of individual choices, we are able to understand the robust evidence highlighting childcare and education as essential pieces of America's economic puzzle. Continue on to the next slide, thank you. So the main ingredient we know to this system is the childcare staff. And certain thresholds of age-dependent child to staff ratios are important for safety and for support of the child development. In this graph, we notice that while hourly wages have somewhat increased, there are large discrepancies between the weekly earnings of childcare workers, the bottom line, and those who work with preschool kindergartners in the red line. Both are below the median weekly earnings for all full-time workers. And often childcare workers experience pay disparity despite having similar education requirements and job responsibilities as K through 12 teachers, regardless of where the work takes place. So in looking at the impact of COVID-19 on childcare, the pandemic really laid bare the precarious economic and social conditions of children and families here in the US, even more so for Black and Brown and tribal communities. And as noted with our Federal Reserve System Childcare Work Group briefing last summer, we really saw how COVID-19 really upended typical care systems as parents lost work or started working at home, and many childcare providers closed. And so we really saw this particularly problematic for our healthcare workers and first responders. And in looking at the unemployment rate for mothers and fathers of young children, we see that it remains elevated. In a past blog from my colleagues at the St. Louis Fed, some of the most significant impacts have been from the pandemic has been really job or income loss. And what we see is that women have faced higher unemployment rates than men. And as the pandemic has affected sectors with high shares of female workers, particularly in service professions, we see that care responsibilities, or we know that care responsibilities for young children disproportionately fall on mothers relative to fathers. And then when you break down the participation rate, so looking at the number of people who are already working or seeking employment, we note that the participation rate has not reached those pre-pandemic levels quite yet. Unsurprising, but telling in the data is that when we compare labor force participation rates for fathers and mothers residing with kids, for fathers and mothers with kids under 5, we see too that there's been a drop between mothers' average labor force participation rate in the first quarter of 2021 versus the first quarter of 2022, where it's about double that of fathers. So how does this relate to rural areas? Well, both urban and rural areas face childcare challenges regarding availability, affordability, and quality. But several challenges are unique for rural areas. The rural childcare market relies more on home-based family childcare businesses, and these providers face challenges with capital for startup, equipment, facilities, modernization, businesses and technical assistance, and providing training and platforms that are accessible to remote providers. And while some costs are lower in rural areas, so thinking about the cost of living compared with urban areas, family income levels are also lower, which puts pressure on profit margins. And overall, rural areas are more likely to be classified as childcare deserts. So thinking about those childcare deserts defined as less than 1 licensed childcare slot for every 3 children. According to the Center for American Progress, they estimate that 2/3 of rural families live in a childcare desert. And we look at more at the market of home-based family childcare. We see that that market is really often in those urban families. So on the next slide, we see a chart that shows the difference in rural and urban use of home-based non-relative care for infants and toddlers and preschoolers. In rural areas, 28% of infants and toddlers attend home-based non-relative care compared with 24% in urban areas. Meanwhile, in urban areas, 22% of preschoolers attend home-based non-relative care compared with 10% in urban areas. So prior to the pandemic, the data really showed that family childcare businesses were actually in decline in many parts of the country relative to childcare centers, which has implications for our rural areas that depend more on these providers. And so what I want to be able to leave you with is some of these takeaways with you as we continue to explore through this conversation how childcare is both a workforce support and contributes to the foundation of children's education. And so we also want to just highlight and share that not all rural communities are the same, and that these solutions will reflect industries and geographies of those areas and also their racial and ethnic composition. And as immigrant communities have grown in a number of rural areas and the share of Hispanic families in several rural communities is growing, today we will hear from the likes of Barb Farber as well as Corrine Hendrickson, who will share some of the challenges both in these childcare deserts as well as tribal communities. I do want to say that the good news for rural communities is that it's often easier for us to be able to gather a cross-sector group of stakeholders to develop these local solutions. So with that, I want to turn it over to our first speaker, Corrine Hendrickson. Corrine, again, is the owner and operator of Corrine's Little Explorers Child Care Center in Wisconsin. And I'm so happy to be able to talk with a practitioner, a provider who's on the ground. So Corrine, if you could just kind of give us a landscape as a provider as to what you've seen, what you've experienced, both before the pandemic, and then what are some unique challenges in which the pandemic has brought along.
So hi, I'm Corrine Hendrickson. I'm a family child care center in New Glarus, Wisconsin. I've been open for about 14 years. I have 2 sons. So my oldest was 10 months old when I started. I had 3 friends, all pregnant. So I started with babies. But in Wisconsin, we have been in decline since 2010. So with the Great Recession, childcare was not invested in at all. So what happened was we made it through, and then the birth rates dropped and plummeted. So then many of us ended up closing, weren't able to make ends meet. And then as the economy kind of came back, the childcare wasn't there. So all of a sudden people started wondering what had happened and where the kids were supposed to go. Wisconsin also has one of the highest rates of women in the workforce. We have 70% of women with children under the age of 5, as opposed to the rest of the country with about 60%. So we already have a higher amount of people who are looking for care for their young children. You also have had declining numbers. 69% in Wisconsin for family childcare are gone since 2010, and 9% of group centers are also gone. There was also issues with the workforce pre-COVID pandemic because our wage rates are so low at $10.66 an hour. Went up a little this year because of all the grants and things, but because the wages are so low, we just can't get people. So our group centers ended up, would not be at full capacity because they couldn't hire enough teachers. So there were also, slots that theoretically existed, but really didn't. With COVID, it has been so much worse. I don't know any group providers that have all of their rooms open right now because they can't find people. Because you can go anywhere. You can go down the street to the convenience store and work, a far less stressful job for better pay and benefits. Where in Wisconsin, over 40% of us end up relying on government subsidies and things for healthcare, et cetera. Wisconsin also hasn't taken the expansion, so that hurts us a little bit more as far as being able to get staff that can get paid a little bit more, but now they don't qualify for Badger Care, which is our healthcare subsidy. We also have, let's see here, over 50% of us have at least an associate's degree. So in Wisconsin, normally you'd make $18.72 with that associate's. You make $10.66 here. Again, no benefits, but with that associate's, you'd have benefits. For myself, I have a bachelor's. If I was to get paid what I should get paid with a bachelor's degree just for the teaching portion, not for running my own business, I would have to raise my rates $120 per week per child, and I have 8 children. So parents just can't afford that. So we're really kind of in that weird position where we need to raise rates to pay ourselves, but parents can't afford it. So we really need to come up with some other solutions. Wisconsin was really good with the COVID pandemic, though, dollars. We took $111 million from the COVID relief between March and December, and about a third of that has gone straight to the workforce to pay wages. So family childcare, we got stipends. Group centers, the workforce got stipends that went directly to us in order to help us increase our profit for family childcare or wages so we could keep people in the field during these times. And then Governor Evers also allocated $80 million last fall out of his Wisconsin-based, whatever he wanted to do with funds. And that also same kind of stipend went, some of it went to parents, some of it went to our program costs, and some of it went to us.
Yeah. So I understand that you're a part of a network of providers. And so how much has that meant as through the pandemic and as you guys begin to think about and pivot, or as you're thinking about pivoting to recovery?
So the shared services networks just got started up in the last couple years in a couple really rural counties. They actually didn't have any childcare at all available. And so that got started and it has expanded. So this last fall, in the middle of the pandemic, they expanded to the southwest corner. So that means that I was able to get sanitizer, PPE, computer, a hotspot. I did virtual learning. So that hotspot saved me a few times when the internet went down because they were upgrading in our area. So I could keep the kids going on their things along with my own children. They were virtual. And there's a relief squad, which I'm really excited for. So one of the biggest barriers for family childcare is I can't go to the doctor. I can't go to the dentist. I can't take my kids to the doctor unless I have somebody that can cover for me, which is almost impossible. So this relief squad is going to be, I get 10 days a year to take, appointments. If I need somebody to come in and help me, if I would like to, sit and do paperwork for 4 hours instead of working on the weekends and nights, because I put an average of 75 to 80 hours in a week between all of my things and 50 hours with kids alone. So it's definitely very, very excited about that for the Shared Services Network. It is expanding also in a couple more counties because of all of the extra funding coming through, which has been very helpful. And then also my county workforce development has been very, very great to work with in this last year. So we connected and we were supposed to get together and she was supposed to come visit me. COVID happened, so that didn't. But so the United Way and the Greene County Development Center and Greene County Childcare Network, which I'm a part of, all got together. via Zoom, and we talked about what we needed. So we started out with, oh, we could use hand sanitizer and soap, and our Kara goes, no, that's not what you need. Tell me what you need. So then they ended up creating this great system. So we did a business boot camp where people who already were in business or people who are interested in being business group and family center, we did a 8-week course, everything business related, and now it's going statewide. So that's pretty exciting. That just happened, and they'll be hitting the 4 other quadrants in the state in the next 2 months. And they had a safety Saturday, so we could get our basic, health and safety things taken care of for free, which is another huge burden for us to pay for ourselves and for our employees if you're a group center. We also have been doing, they did a toy drive for us. They have done, they wrote a preschool development block grant. So we got $50,000 to do mentoring. So those of us who are seasoned can be mentors to new providers or those wanting to improve their quality rating and get paid. So we've always done this for each other for free, but we're getting paid for it, and we don't have to make that other business pay us because we know that there's no profit in it. So we do everything we can to help because we really are, families to each other too. So that's started going. We also, mental health has been something I've really been working hard on with a couple other colleagues. And so part of this is we are with another counseling service in Monroe. They're providing services to 12 of us providers programs to talk to us about what we need so that we can, be confident and have our buckets filled so we can work with those kids. And then also in order to work with the kids and get us resources for things, because the expulsion rates are horrendous and it needs to stop. But every single program should be able to take every single child and include every single child. So that's what the idea for this is, so that the kids are part of our group, part of our families, and we meet their needs where they're at in getting some of the access, because in rural areas, we don't have access to any of that. And I can't pay a therapist to come in $100 an hour to work with me and the kids. So that's part of our preschool development block grant that we've been doing too.
Oh, that's great, Corinne. And thank you so much for being able to kind of share some of the equity issues that you and your network has been able to face and the unique ways in which you've been able to meet children and families where they are and being able to provide those services. So I think this is a great way for us to segue to our next speaker, Barb Farber. Barb, welcome. As you heard with Corinne, provide some context as to what she's experienced as a provider in her childcare desert. Share with us what's happening in tribal communities.
Hi, bonjour, thank you. My name is Barb Faber, and I'm a Ojibwe enrolled member of the White Earth Nation. Very proud member. I've worked with the Child Care Development Block Grant for about 27 years, and I worked for about 30 years. And so I'm very, very in tune with what is happening in childcare. And it's an area that all our communities need. And I thank you for all the great information you provided, Sam, on your PowerPoint. So as you know, that there are over 500 beautiful Indigenous nations across our country. And of those 500, over around 260 of them that represent the 500 nations receive the Tribal Child Care Development Block Grant, much the same as the states receive that. So that is a lifeline to states and tribes to help create and enhance childcare for our communities, which is great and absolutely needed. But we also need a lot more than funding. We need resources. We need policies that work for childcare providers, like Corinne was saying. There's a workforce issue that, along with the payment rates, that are keeping the childcare deserts very active, both in rural and tribal communities. And so what I've done over the years is for my tribe, we created a very high quality early childhood childcare system for our reservation and our families. We licensed our own childcare providers. We provided childcare assistance for families. We provided training and quality because of rural areas, there's less resources. And so we have to create those resources, and we have to be innovative, and we have to do a lot of outreach and communication and collaboration with our state, with our funders, with policy people, and to let them know really what's happening. Over the years, I invited and brought many people to my reservation, both federal, state, and foundations, so that they can actually see what rural tribal communities look like. And I think that perspective provided insight to them on really what we're facing out here. And so so we were able to, pretty much spoil our childcare providers so much that, we provided them lots of quality improvement and training. And like Corrine, a lot of them had associates, are working on their bachelor's or had their bachelor's. And that was, while we were doing that, our tribe also was one of the 4 transformation zones in Minnesota when Minnesota received the Race to the Top grant. And that provided us also with an opportunity to deliver a new and innovative early learning program. And that was the early learning scholarships. And the early learning scholarships was kind of, I guess I would say created by Dr. Art Rolnick and with support from Rob Grunwald. They went around and talked to people about scholarships. So scholarships are similar to childcare assistance, but they're a little bit more flexible, and there's parents are able to use that, and there's not a co-payment, and it follows the child wherever the child goes. And in Minnesota, so if they move from the metro to the rural, it followed them. So that was very innovative, and it really, really worked for our foster families and relative caregivers. So that was, something that was fabulous. And our providers, in order for families to utilize the scholarships, they needed to be a part of the Parent Aware, Minnesota's quality rating system, to be approved and to accept families of the early learning scholarships. And that was wonderful, because then it provided that childcare, even though, they may have one scholarship family, all the children benefited in that childcare from the high quality educational experiences they were receiving as part of the quality rating system. It also provided parents an opportunity to shop around, and that would, so it was very flexible, and they were able to find the child care provider or preschool or even Head Start that met their needs. And so they didn't have to travel, because in rural communities, distance is a big thing, and it's usually, at least a half hour from anything. So time matters, and distance matters in rural communities. The other thing I would say about that is it was backed by data and research. And so Rob and Art were able to provide the data to prove that works. So that's one of the things that I was proud of, and hope that more communities look at that. But as far as the Child Care Development Block Grant that we administered, that allowed us many opportunities to create our own tribal childcare. And so that our childcare providers, looked and talked like the children are our children. They They practice our customs. They used our language. And so it was very familiar to our children, and important to look similar to their parents and the language that was spoken in their home. And so having those kinds of innovative opportunities and dedicated funding has really helped us. And because of that, also we had, our tribe decided to license non-tribal members within our tribal boundaries. Again, that helped us, create more capacity. And so we had probably about 7 county or state licensed childcare providers who were non-members come over to the tribe and get licensed, which brought our numbers up to about 21 tribally licensed childcare homes. And most of them, I think, maybe with the exception of maybe a couple of them, they were all rated by the state's quality rating system.
Oh, that's just excellent news, Barb. And so as you're thinking about moving from the early, childcare scholarships, and how have they been able to stabilize these providers as through the pandemic, and what does this look like for the future?
Yes, the scholarships are still happening, and the state is still administering those. And so I believe there are 3 tribes in Minnesota, 3 of the 11 tribes in Minnesota that are administering the scholarships. And so we hope that that expands. And as far as the Child Care Development Block Grant, I believe there are 9 of the 11 tribes that administer the tribal CCDBG. And so even with that, though, even with those funding sources, we're still experiencing childcare deserts for the many reasons, that everybody's heard about today. And so we really, really hope that, that those continue. But, if you look at documents or reports from 30 years ago, we are still experiencing the same things, that was happening 30 years ago. And so we need to try something different. We're still dealing with childcare deserts. We're still dealing with, high poverty and, our Indigenous and, our BIPOC communities, still have some of the highest numbers of unemployment, the dropout rates, or suicides and deaths and health related issues. So, we need to try something different. And so I'm so excited that, when there's more collaborators at the table, such as the private sector and federal officials, state officials, policymakers, all come together to try new things. And the early learning scholarships is one of them. So we really, need those. We need a lot more, but, and so, I left the tribe a few years ago and started my own company, Indigenous Visioning, where we work with within tribal communities. That's my passion. And just to support tribes. Tribes are the experts for their communities. And we just want to work with them to support their efforts around supporting childcare. And we have, a few years ago, we took a tour, the first tribal early childhood tour around the state, visited tribal leaders and their early childhood professionals, and just had the conversation. And it was a wonderful conversation. And the conversation was, childcare was almost the number one, along with language revitalization and the workforce. So then we also then asked, we went around with the PDG and the state's preschool development block grant and was able to communicate with parents. And we asked them the same questions, pretty much the same conversation. And childcare was also at the top of their list. So it is a problem.
Yeah, well, thank you so much, Barb, for sharing. And when we bring back all of our speakers together, hopefully we'll be able to have some of the questions to unpack more of the discussion that you provided. And next up, we have Travis Staton with Goodwill United Way, Southwest Virginia. And we heard from Barb talking about several of the partnerships that she's been able to go. And we know that as we're thinking about the unique challenges that we face in rural communities, that of course it takes partnerships and collaboration to get this done. So Travis, give us a little bit about how you and your organization, your large nonprofit organization, has really been able to kind of serve as a key collaborator in bringing about early child care.
Sure. Well, thank you and good afternoon, everyone. Over the last decade, United Way of Southwest Virginia has really worked to redevelop itself and developing a new initiative based on a cradle-to-career approach to sustaining solutions to really better prepare the generation for the workforce of tomorrow. As we've reshifted and adjusted our work from treating symptoms to addressing root causes, we've really moved from being recognized as a premier fundraiser and distributor to an organization focused on the bottom line results, lives that are changed in the communities that we shape. In addition to this focus too, we've also brought our efforts to scale through the organization through 8 different mergers and acquisitions to now overseeing geographic operations of 17 counties, 4 cities, about 20% of the Commonwealth. Although that may be 20% of the geography of the Commonwealth, we're still very rural. We only make up about 5% of the state's population, 500,000 folks, and we still have about 50% of our citizens that really struggle to make ends meet and really are either in the poverty level or an acronym referred to as ALICE, that are working individuals that really just don't earn enough to make the cost of living in their community. But childcare is extremely important to rural communities. Not only does it help parents and caregivers remain gainfully employed, it also supports our local economies and makes us attractive to major employers and higher paying jobs. But the most important reason why childcare is really important in our region is it helps our future workforce for tomorrow to be ready to succeed in kindergarten and on up through their K-12 careers. And we know that by investing early on in those children and their lives and those family and child supports, that we can really have a great return on that investment. Over the last decade, we have worked aggressively to make sure that there's access to childcare, that there's effective utilization, that it's quality childcare, and really making sure that we are supporting children and families. Today, United Way of Southwest Virginia currently operates about 16 different initiatives in this space in partnership with the Virginia Early Childhood Foundation, the Virginia Department of Social Services, and Department of Education. We're operating about a $5 million annual portfolio, working with more than 200 childcare providers, serving over 10,000 children and families. Our region's challenges are like many that you've heard today already: access, affordability, but also the challenges of having a qualified and a workforce for these providers. We've worked over the last decade with folks such as the Appalachia Regional Commission to really help and develop child care centers where historically 0 existed in some of the rural parts of our community. COVID-19 has had an impact on all of us and definitely our child care sector. At the beginning of the pandemic, less than 20% of those centers remained open. Working parents, mostly low-income earners, also had jobs that wouldn't allow them to work remotely. They had to work at the grocery store, or had to work at the laundromat, or had to work at a hospital or a doctor's office, and they still needed that child care. But we also had parents that had school-age children that typically didn't have to pay for care during the school year because their children were at school during the school year because those schools were open. Of our workforce in our community, among 51% of those are working right now, but more than half of those that are employed in our communities are working hourly jobs. Those individuals were very vulnerable during the pandemic, especially on working essential jobs and having access when only 20% of the market was open. Our team really worked very closely over the last year with several different child care providers and families and initiatives. Our strategy was really based on two fronts. The first phase that we really saw was over the first couple of months of the pandemic, were really to concentrate on market stabilization and preservation. We needed to keep centers open and keep the ones that were providing services able to provide services, and really make sure that we didn't lose what a vulnerable community already had not enough adequate care of, that we didn't go backwards in what our market had. So providing that stabilization, we concentrated on things such as cleaning supplies, sanitation supplies, helping our centers have access to food. Many of us all know that you couldn't buy cleaning supplies, you couldn't buy milk, you couldn't buy flour. All of those things, our child care centers that were open needed those supplies. So we were able to work regionally with community and the private sector and businesses to make sure that we could stabilize that market and keep what was open, open. We also provided several hours of technical assistance to all child care providers to help them gain federal and state supports, like loans from the Payroll Protection Program, in order to keep their doors open or to keep them stable so that when the pandemic did go away, that they could reopen. As we got through market stabilization and really preservation, we knew that we would continue to have to adjust our strategy. So phase two really was about concentrating on expanding access and getting the rest of those 80 centers back open, but also developing a solution for a new problem, which was based around school-aged children while schools were closed. So we worked with local governments in our community and piloted several projects where we worked with 20 child care providers and created a subsidy program using federal CARES Act dollars to provide tuition assistance to working families to have child care while they were required to work, but also at little or no cost. Through that initiative, we were able to create 300 slots working with those providers and really help those providers to take this new leap to serve school-aged children. We also did that. I'll be very honest, providers were very concerned about expanding their operations and really working to serve this new clientele because they weren't sure. None of us knew what the pandemic would bring each day, and they did not know if schools were closed today, if they were open tomorrow. If we hire staff and expand our operations and kids go back to school, we have a lot of investment in that. So we worked with those county governments and the federal CARES Act dollars and guaranteed those tuition regardless of the school schedule, as long as those children were either in school or at the child care provider, regardless of the schedule. But in order to do that, we had to have trust, we had to have collaboration, and we had to have credibility. We worked with the Virginia Department of Social Services and the Virginia Early Childhood Foundation on a daily basis. Through those state partnerships and those developments in our community, we were able to leverage their support with local support, building that private-public partnerships in order to succeed. With that model, we worked with the state and the Virginia Early Childhood Foundation to expand what we did. Today, we expanded that among 40 other different providers and now have created more than 700 slots for school-aged children, working with early child care providers to make sure that they had care during the pandemic, but also these providers now were able to diversify their business portfolios to earn additional revenue, but also help the community to see how important public and private partnerships were. But when COVID's over and our communities come back together, we still have providers now that have new relationships with school systems and may be able to even provide after-school care, expanding their capacity and making them potentially more profitable and more stable to even provide those services for those children birth to age 5. Today, 95% of our providers are now back to open. We lost less than 5% of those providers through the pandemic, and we are continuing to work very closely with the Virginia Early Childhood Foundation and the Virginia Department of Social Services as we continue to grow and support our providers.
Oh, that's great, Travis. Thank you so much. And so as you're thinking about United Way and looking towards the future, yes or no about have you seen that network and relationships of trust moving forward on these recovery plans of integrating for your economic development conversations?
Yes, I think it's in my 15 plus year career here at the United Way, the conversation of childcare has never been elevated at this level before. For the first time in many years, economically now, employers and economic developers see the importance of quality childcare and accessibility. So now is a unique opportunity to continue to build that trust, not just within all of our normal stakeholders and providers that each of us work with in our work, to really expand that to those private sector folks, to the businesses, to the local governments, in order to continue to grow and develop that early childhood ecosystem in each of our communities.
Great. Thank you so much, Travis. So before we bring all of our speakers together for question and answer, we will hear from our last speaker, Allie Richards, in a pre-recorded session. Allie Richards, again, just want to let you know that she serves as the CEO of Let's Grow Kids in Vermont, a movement that really works to support equitable childcare and education. And Allie's going to be able to give us a real overview of the childcare landscape, both prior to the COVID-19 pandemic and during in her state, and how Let's Grow Kids really built a movement to build awareness, provide technical assistance, and critical investments to ensure that all children in her state have been able to have access to affordable quality childcare. So take it away, Allie. Let's hear about it.
Thank you so much, Sam. It's such a pleasure to be able to be part of this conversation and interact with you all, such as it is today. And thank you for allowing me to record this in advance. And I have a team member that's joining you all for the breakout as well. So between the two of us, I hope we can really answer any questions to really paint the picture of Vermont. And again, Vermont. So we're a rural state. We're small. We're tiny. We're known for our natural beauty and strong communities in a lot of ways. But I want to be clear, like the rest of this country, we have a childcare crisis. Just to put it in perspective for folks, we have 643,000 people in our entire state. So really, we're talking about quite small numbers here. And like many other rural areas, we are seeing large mounting, challenges. A lot of them are around demographics. So an aging population, wages are largely stagnant. In many cases, businesses are having a lot of trouble recruiting and retaining talent. Working parents cannot make ends meet. For all of these reasons, childcare continues to rise up as what is a solution? What is one way we can put our shoulders sort of together here towards a real solution for all these things that ail us? How can we really dig deep into the needs of Vermonters and really start us towards thriving communities and where we know we need to do? Well, of course, that starts with our kids. It makes tons of sense. So what's happening in Vermont, though, before the pandemic, we have 30,000 kids under the age of 6 in Vermont. And the vast majority have all available caretakers in the workforce. This is something that has really changed in our society that we haven't really kept up with. And so what does that really mean, the numbers in Vermont? 3 out of 5 of our youngest kids before the pandemic did not have access to the childcare that they needed. 3 out of 5. It's an absolute crisis. And those who feel lucky enough to have found one of those spaces are paying upwards of 30% of their household income, regardless of socioeconomic status, for that space. And early educators are paying dearly to provide this essential service by not taking a full wage. In Vermont, $13 an hour is the average wage. So like elsewhere, this should not be new. It's just grounding us in the numbers that even before this pandemic, we had a real crisis of access affordability, and the funding to promote a full high quality system. So, Vermont families can't afford to pay more for this, and early educators can't afford to make less. So I just have to pause for a second on a personal front. Anecdotally, I have 2.5-year-old identical twin boys. It took until they were 11 months old, Sam, to find them childcare. even though this is now become my life's work. And I lost that childcare because of the pandemic. So I'm actually in my parents' bedroom and they are supporting me with childcare during the workday during the pandemic. And we're so close to maybe getting those spaces back finally again here. So I'm just, you know, I'm living this and I'm working with it every single day. And now the question is, what can we do about this together? So as you mentioned, Let's Our Kids is a movement. You know, it's a movement, it's a campaign to secure public investment in Vermont's childcare system so that we can have an affordable, high quality, sustainable, and equitable childcare system for all who need it in Vermont. And we know that's going to take lasting, sustainable public investment, because the truth of the matter is we've had childcare in this state and in this country, but we've never funded it. We've never funded it so it could work. And so how do we do that at Let's Our Kids? We've really married a couple key strategies. We're really empowering people. We've over 30,000 people in Vermont from all walks of life engaged in some way in this movement. You know, taking action, calling their legislator, writing an op-ed, having a house party, spreading the information, spreading the value, the understanding about this issue. But, you know, it's really about empowering people, lifting up their stories, and this is a human-powered, you know, movement. But we also work with programs. This is something that's a little unique. We're in communities today actually saying, what are your gaps? How can we help you with community solutions for fixing childcare? And what we learn is, you know, we build economies of scale. We find streamlining measures like shared service models. We support business practices, and all of that leads to policy implications, but it also helps ready the system for investment. So that's married to our policy program, which we basically are fully advocating for a public policy change and investment in the system. So that's a little bit of the painting a picture of who Let's Our Kids is and why, our situation in Vermont, our size, and like elsewhere, what are the challenges? It's the funding, it's the money. You know, I would have to say COVID has really exposed so much about our lives, and it exposed the fact that we can't go back on this issue. We need childcare. Our families need childcare. Our children need high quality, affordable, accessible, equitable learning environments. And it's something that's so important to all of us, to our economy. And we don't have it. So we gotta do something about that. And it's about, can we afford it? And our proposition is, we can't afford not to do it. Of course we can afford it.
So you were talking a little bit about how you all really use some unique opportunities to build this storytelling with your volunteers and expanding the tent around who's involved in really pitching, you know, taking forward this conversation around how crucial childcare is to the workforce. So tell us a little bit more about how you've expanded the tent to showcase how childcare is connected to economic development in the state.
What a great question. Like I said, I can't believe almost we're in this moment right now, nationally and in Vermont, of, you know, the sort of smoke being blown away from these inequities and these issues in our society that we just have not addressed. It's almost now we've moved past the case-making phase in childcare collectively. We know it's essential. And even we have polling just to make sure that, you know, those of us that live and breathe this every single day aren't, you know, making this stuff up. So our polling is so strong, Sam, recently. It's shown unprecedented levels of agreement, not just around the essential nature of childcare, but the essential nature of this to reopening our economy, and also in the need to connect the dots that public funding is what's necessary. So 78% of Vermonters from all backgrounds, with kids, without kids, high income, low income, north, south, said in pretty equal numbers, Republican, Democrat, Independent, by the way, absolutely bipartisan, that we must increase state funding to fix this. So the polling is there, the public support is there, and it's almost now, like I said, the expanding the tent is almost around, so now what are the specifics? And how can we rethink about affordability? We all, especially in rural environments, struggle with a finite nature of our funds. There's only so much money available. So how do we spend it really wisely? And our whole point is, let's rethink this. The status quo is not working for anyone. As I started with, stagnant wages, people working multiple jobs to make ends meet. Businesses cannot grow. They can't even fill their openings right now. Huge challenges that constrict our economies, especially in rural places. So what is something that's going to flip us out of that? Childcare is that example. We've been able to show that when you invest in childcare, it is not an expense. You have an immediate stimulus like effect on the economy. And what do I mean by that? Immediately upon making an investment in childcare, you lift an entire sector of mostly women out of poverty wages, because a lot of the funding goes to fair compensation for early educators. It also goes back to the pockets of Vermonters, because they can now afford childcare instead of paying more than their mortgage on it. It also goes to create thousands of jobs to meet the demand within childcare industry. And it goes to thousands of jobs being created because people can be in the jobs they want to be in because they have childcare now. So it has an immediate stimulus-like effect that pays for itself. And that doesn't mention the demographic pull that will have a big effect on reducing our collective tax burden. That doesn't even get into the return on investment over a lifetime for these kids and the families when they actually get what they need to thrive from day one. So we've been able to make a really strong argument about the economics of this, and we've had our business leaders be the spokespeople. One, again, thing that came out of COVID was the strength of CEOs of all different sectors and size businesses. They need to be with you on this one, because they can make this argument. They turn people's heads. We've been making the moral argument about taking care of our kids for a long time. I almost hate to say it. It was, you know, until we started making the cold, hard capitalist case that people were finally paying attention in some ways, you know, certain audiences. And so our business community, when they say, not only is this a moral imperative, it's also an economic imperative, and we can prove both. And every year that we don't have action, we can't hire, and our kids are not, we're losing whole generations of children. That's what's really taking off with the momentum that we're having here in Vermont.
Oh, that's so great to hear. And it kind of really talking and providing some of that advice for that. So let's share some of those successes that you guys have been able to have. Have you guys had any success? On what level? And what does the future look like? As you said that you plan to sunset in 2025. So how do you guys get there?
Such a great question. So we've had wonderful success, you know, everything from, for example, we've been able to really, well, I'll start with the punchline. This week in Vermont, H171 is a bill that has just passed the legislature. It makes $12.7 million in immediate investments in our childcare system today, affordability, an IT system that undergirds the entire transformation, and loan forgiveness and scholarships and other supports for the early ed workforce. It also puts 2 studies in place that identify long-term sustainable funding sources and ask systems governance questions, the final questions we need to get this done. It's year 1 of a 3-year plan, and it only had 1 no vote in our entire House Representatives, and it had a unanimous vote out of the Senate. So it's literally an immediate investment of the beginning of a 3-year plan to fully fund and finish this job. So it's pretty incredible, and we're feeling really excited about this week, but we are not ready to celebrate because the hard work is still ahead, getting a revenue bill passed and getting these final pieces of the policy in place. But that being said, you know, we've been able to increase the quality of our regulated childcare in Vermont by 48%, including eliminating many of our childcare deserts through this work policy and programmatic work that's married together. And, you know, we have the early ed workforce taking a leadership role. Over 75% of the early child educators in Vermont are calling for increased investment, and they're part of the discussion saying, what does it look like to have a profession? And what does it look like to pass this policy and the details of this policy? So we're very excited. Quality is increasing, funding's increasing. We have a 3-year plan, and we're ready to rock here. We want to show the world what happens when you take care of your kids and families. I, again, don't want to sugarcoat it. We have some really heavy lifting in the next few years. We can't wait to share our learnings and learn from so many others. We've already, you know, accelerated our work, being able to partner with so many others. And we really just want to show what amazing things happen for your rural communities when you take care of your kids and you get high quality, affordable, equitable childcare right.
Well, Allie, thank you so much for that. Just incredible sharing what you and your Let's Grow Kids, that movement has really built over time. And just wanted to know, is there any kind of lasting recommendations you provide as other states at the state level may be thinking about, you know, for implementing a similar movement in their own state? So any lasting advice you might want to share with us on that?
It's such a good question. One is harness this moment we are in. The world just saw that we cannot go back to normal when it comes to childcare. We can't, literally we can't. This is the workforce behind the workforce. So the folks are celebrating a return to some sort of normalcy, but you actually literally can't do that if you don't have childcare. And we can't go back to what was the status quo before. So harness this moment. There's energy there, there's understanding like we've never had before to really push through. This is a bipartisan solution that really affects so much of what we care deeply about in our society and our culture. It affects so many different things upstream, like you mentioned earlier, Sam, equities, economics, just the general well-being of our kids and families. I also would say, again, we've been finding you really living inclusive lives is a wonderful ripple effect, not just to the communities that we live in, but to these policy ramifications. Really making sure you're recruiting the right spokespeople and the right leaders in your movement. We've really done a lot of deep work, and we're just at the beginning of it, but it really is everything we can do personally and to live those inclusive lives, to create these equitable policies that will have long-term effects to some of these systemic issues that childcare can really have the power to change in so many ways.
Well, Allie, thank you so much for your time and sharing some of those great, powerful resources. I'm sure we'll stay tuned for much more to look forward to the movement that you all are building out there in Vermont. Thank you.
Thank you so much, Sam. Such a pleasure to be here and to talk with you.
All right, we are going to bring back our panelists for some Q&A, and I want to remind everyone, please, if you have questions, please put them in our chat box here. But with that, how about we start with Barb? And if you could just share a little bit more about the partnership that you have with First Children's Finance to build childcare capacity in tribal communities.
Thank you, Sam. Yes, that 12 minutes went really fast. I didn't get to speak on that, but I did put it in the chat, the document. And so that's just another innovative way that we are thinking here in Minnesota, and we hope it goes beyond Minnesota. So First Children's Finance, as you know, is a nationally known program that helps support the childcare business. And so what they do is very successful, and it's growing across the states. So we thought to partner with them. We've been talking about it for a couple of years, and to indigenize that process for tribal communities, to increase capacity and availability and quality. And so working with tribes with or without the Child Care Development Block Grant to help support them, and using the First Children's Finance model as our base. So I attached the document in the chat, so anybody wants to get more information. I believe there is also, it was posted on the website as a resource for this event. So thank you.
Oh, perfect. Thank you so much for Barb for being able to share this great innovative solution, as well as some of the resources to being able to pass on to our participants here. A question I have for all of you is that with the recent rise in consciousness about racial justice and racial reckoning affecting communities and your work, are there any social or economic trends that you guys have seen or have been watching in regards to this in your communities?
I'll say in Southwest Virginia, we have really been looking historically at our makeup of our population, and really have seen that the more challenging our region becomes and the more economically disadvantaged with higher paying jobs, we see the less likely our community is diversified. And we really want to get a handle on that. Over the years, our community has become more homogeneous over the last decade. And we're losing families of minorities, and we're losing young children, and that's not acceptable in our community. So we're working very aggressively to look at how can we work collectively in our communities to make sure that these populations and individuals have access such as everyone else, but also how can we make our communities attractive to all types of populations and cultural backgrounds and ethnicity to really make our communities holistic. And I think coming together around building our economies and also working in this space is a huge, crucial piece of that.
Has any one of you all created a way to support family, friend, or neighbor care in any of the work that you've done? So through any financial support or training or scholarships that allow to utilize for parents to be able to utilize this type of care? And thinking maybe Corrine, you've seen maybe some of this in your network, or maybe even Barb.
Sure, just really quick. Minnesota is initiating some FFN care, which is Friends, Family, and Neighbor Care, through their PDG grant, and providing resources, offering training. We are working with Indigenous FFN providers to reach out to them and offer support, training, and resources, and PPE if needed.
In Wisconsin, you are allowed to access the, it's called Wisconsin Shares for subsidy if you are friend, family, neighbor care. Also, we have such a, it's called certified care, regulated. You can have 3 children under the age of 7 that way, and they can be related to you as well. And then you would also qualify as long as you meet all of the health and safety requirements. So there are ways to access it more in the formal sense of having to, take some of the safety classes and some of the other types of classes. But that way it can meet the needs of those people needing 2nd and 3rd shifts and weekends, because our family child cares can be regulated any 24 hours of the day. So it works that way.
Great. So maybe if we all, if any of you all, so this question is for everyone here, is that since it's an overall workforce economic development issue, our participant asked, is there any recommendations of funding opportunities to assess current daycare facilities and through the expansion that you all have seen?
So one of the things that Wisconsin just did with our December money is that they just opened up, all workforce is eligible to receive a stipend starting this week. We just have to fill out a simple application. And then they did $10 million in investment in technology. So every program got between $1,500 and $3,000 funding to go onto the Kaplan website and pick out what we needed for our program. So headsets, batteries, printer, laptops, boosters, things like that. So that has really been helpful, because a lot of us in the rural areas don't have internet access. So having, the ability to get the PPP was almost impossible if you didn't have internet, because libraries were closed at that time. So that is very helpful. And they're looking at, it's called Child Care Counts is what we currently get with all of the funding that is coming through all of the COVID money. But we're looking at trying to get into our budget called Child Care Strong, where every single month we would be guaranteed a set amount of money based off of if we're regulated, if we serve 25% of children on 2 and under, and also then our quality rating indicator scale. Based on how we do with that, we can get extra additional money for every child, whether they qualify for subsidy or not, and then even more for those who qualify for subsidy. So we're looking at trying to make it so every month you're guaranteed money to really get more people into regulation, to get us to know that this is going to be a better budgeting experience, and just kind of strengthen our systems that way.
Oh, that's great. Thanks, Corrine. Travis, this question is for you. So you mentioned ALICE. So let's see if we can get this acronym correct. Asset Limited Income Constrained Employed. How has United Way really used this as a rallying cry around looking further into early care and providing early care for your community?
Well, it's a crucial baseline and indicator. So the ALICE population are those individuals that are working, earning a wage, but their cost of living exceeds that wage. So often they're referred to as working individuals that just can't make ends meet. They're crucial to our economy, but it also plays in very much in the child care sector. One, we have a lot of child care workers that are of the ALICE population themselves. We also know that upon a certain baseline of pay, some parents, even in the pandemic, would say, well, I might as well just stay at home because my whole paycheck would go to child care. So in our economies, as we try to strengthen them throughout our region, we're really trying to lift up that population and help them earn a higher paying job. But while they are doing and working in that educational attainment, credentialing, and furthering their skills, they got to have access to that child care and quality environment support too. So it's all interconnected. It's an important thread of the fabric in our communities, but that particular population is really a population that's in the middle, that's a paycheck away from poverty, but also with the right supports could be ones that are lifted out and really dramatically change our community.
Oh, that's great, Travis. So now we want to be able to hear from you. So we're going to transition to our breakouts. I do want to note that while Allie Richards will not be with us, her colleague, as she mentioned, Luann Benatti, will be able to join us in one of the breakout sessions. So please feel free to kind of join one of those, continue this conversation, and we want to be able to hear what's happening in your own community. I will note too that there will be a waiting room to be able to access that breakout. So stay in that waiting room, and then we'll be able to let you know, let you in just a minute or two. Thank you.